Today I decided to share a few personal thoughts. This is meant to improve the quality of medical care, to share my own experience and to synthesize the material that, most of the time, we have to go through as well as possible, as briefly as possible, and as efficiently as possible. Today I want to talk about 3 elements that profoundly influence medical practice, and that most of us are probably not fully aware of. For me, medicine is like an orchestra, like a performance, because in the end, your knowledge is worth nothing if it doesn't reach the team. Rarely is a patient treated by a single doctor. Most of the time, it is a collective effort. Here I will mainly refer to my experience in intensive care, where I have spent most of the last 12 years. Let me give you a very concrete example. No matter how good and well-trained you are, if the cleaning staff does not properly disinfect the room, your effort will, over time, amount to almost nothing. Within a few months, the ward will have a nosocomial infection rate above average. That's what I mean. The smallest detail in teamwork has the greatest importance. I see this system resting on 3 pillars: ourselves, our relationship with others, and teamwork itself. I'll start with the first, ourselves. It would be very easy for me to talk about poorly trained residents or colleagues who don't know enough, but I think it's much more honest to start with myself. When I arrived in Germany in 2012, I started anesthesiology. Only after about a year did I start doing night shifts. In retrospect, that was a luxury. My department head at the time had a very strong safety culture and would never let anyone do on-call duty unprepared. The hospital was small to medium-sized, about 350 beds, with orthopedics, trauma surgery, visceral surgery, gynecology, internal medicine, and vascular surgery. The special thing was that during on-call duty, you were the only anesthesiologist in the hospital, responsible both for the operating rooms and for a 12-bed intensive care unit. I remember very well that I don't know if I was terrified, but I was certainly scared stiff. I kept asking myself how it was possible to leave me alone. I could decide anything, in any direction. Either they were irresponsible, or I was not capable. That discrepancy was hard to digest. One of the big stressors was pediatric trauma. Children are not small adults. Everything is different. And at that time, I was not at all experienced with them. There was also obstetrics. In my mind, there you had only things to lose: 2 patients at once, blood, hypoxia, seconds that matter. On my first on-call shift after doing the ICU round, I sat down and started running through all possible catastrophes in my head. Helicopters, polytrauma, pregnant women, children, everything. After about an hour, trauma surgery called, a 5-year-old girl with a fractured arm. Exactly what I didn't want. I don't remember how many times I calculated and recalculated the doses. I was glued to the monitor, but everything went perfectly. 45 minutes later, I handed her back to her parents, awake and well. Years later, I came to a conclusion. It is not a shame to admit that you don't know. For me, this is the first pillar of good medical practice. In intensive care, when something goes wrong, you don't have time for ego. Oxygen saturation drops. You have to act now. You disconnect the ventilator. You ventilate manually. You check the tube. You check the pressures. You look for the cause systematically. In an emergency, the switch to top-down is best done by changing the question, "What does he have?" to "What does he need?" I still have no idea what the patient has, but I am able to work on him. You can apply therapy without immediately knowing the cause. You can't be good at everything. You can only be very good at what you do consistently. The first obstacle to efficiency is the refusal to acknowledge our own limits. The second pillar is just as important: the people we work with, the nurses, the residents, the other doctors, and the way in which, as a team, we manage to bring out the best in each of them. Here, I have always been particularly lucky. I have felt welcome in every intensive care unit where I have worked. I loved this environment. At the same time, I saw many colleagues who were constantly hitting a wall with the nursing staff. For a long time, I kept wondering what I was doing differently. The answer came slowly, but it was simple. I admitted when I was wrong. In intensive care, good decisions are made as a team. Doctors come with the plan, but nurses come with reality. They stay 8 or 12 hours next to the patient. They are probably 80% of the soul of the unit. If you want to bring out the best in them, you have to start with 2 simple things: listen to them honestly and acknowledge their merits. If it later turned out that I was wrong, I went back and simply said, "You were right." It would have been better that way. No drama, no ego. Let me give you an example. We had a pediatric patient, 4 years old, ventilated during the COVID period. Suddenly, the ventilator pressure started to rise. We couldn't find the cause. The ICU nurse, without saying much, changed the ventilator filter. The problem disappeared instantly. It was condensation. My first reaction was to say, "I'm glad you're here." In the handover report, it was clearly documented that he was the one who solved the problem. Because I chose to be human, not a statue, I gained something extremely valuable: the loyalty and maximum involvement of the team. If the first pillar is, "I don't know," the second one is, "You're right, thank you." That is what brings a team to life. That is what real safety culture is. You build a network around you. It's no longer one pair of eyes, it's 10. And that is what makes the difference. The third pillar is, for me, the true meaning of teamwork. Teamwork means taking care of the people you work with. It is easy to reach a good level. It is much harder to maintain it. No one can function at 100% every single day. We all have good days and bad days, sleepless nights, fatigue, thoughts that take us out of focus. That is perfectly normal. In a healthy team, if today I can only give 80%, the others take over the missing 20%, not because they are forced to, but because they want to. You cannot always control the dynamics between people, but you can lead by example. I've always tried to be the kind of parent of the team. If a nurse had to turn a patient and I had nothing urgent to do, I didn't wait. I geared up, put on gloves, and helped. Exactly. These things spread through the team like fire and increase respect and willingness to help. The tragedy is not forgetting a task. It's the lack of understanding. I remember one of my last shifts in intensive care. From 8 p.m. to 4 a.m., I didn't drink, I didn't eat, I barely breathed. A 2-year-old child with a liver rupture, a 13-year-old crushed by a football goalpost, septic patients. It was relentless. At 4 a.m., the same nurse said to me very calmly, "Now you're not doing anything, you're going to eat." I went, I ate, I drank. When I came back, I was a different person. Because I had taken care of them, they were now taking care of me. It is not enough to learn protocols and algorithms. We also have to learn how to build safety nets around the work we do.